The rise of measles.
Cases are on the rise.
In the West Midlands, measles cases last year.
Everyone everywhere is talking about measles all of a sudden. It's a disease that many of us won't have seen before, but it's making a comeback, and that's got top health officials worried. Particularly because certain parts of the UK are becoming hotspots for the virus, and measles can be serious and spread very quickly. You've got loads of questions and queries about measles, and in this incident room, we're going to try and answer some of them and work out why we're in this situation. Coming up,
my nephew's autistic. He had signs of autism before he'd gone anywhere near an MMR vaccine.
With the best will in the world, even though you want your children to be vaccinated, it's not top of your list of things to think about. How to feed your family may be more important than getting them vaccinated.
Just because somebody lives in the inner city, for example, doesn't mean that they are the sole reason that the vaccination uptake is low.
I'm a mum, I've got 2 young kids, I used to be a doctor, and I'm a BBC health reporter too. Children's health is not always a straightforward issue. Parents want the best for their kids and to keep them well. But it's not always easy to know what to do, where to do it, when to do it, or even who to listen to. Why has the virus come back, and how can we get rid of it? Dr Ranj, thank you for joining us in our incident room.
Thank you.
First of all, what is going on here? Why are the numbers of measles cases rising?
Lots of reasons, but one of the main things is that we've had a drop in something called herd immunity. Now, I don't really like using that term. I prefer community immunity, because what we're referring to is this sort of collective protection we get in communities when enough of us are vaccinated against an illness. There will be people who cannot be vaccinated for whatever reason. But if enough of us around them are protected, then when an illness crops up, a particular one, it doesn't have a chance to spread. And that varies according to how serious and infectious an illness is. So for something like measles, that's quite catchy, it spreads very, very easily and quickly, we need quite a few people in the community to be vaccinated. In fact, we need 95% at least of people to be vaccinated for us to get that collective protection. The sad thing is, at the moment, if you look at the UK sort of average across the country, only 85% of under 5s, children under the age of 5, are fully protected against measles. And that means you've got 15% of children who are vulnerable, and we haven't hit that 95% sort of benchmark, which is why we're seeing rising cases.
Who is it that's most at risk if they get measles?
The groups we really worry about, because they're more likely to become seriously unwell or develop complications from measles, are children under the age of 1, and they're the ones that can't qualify to be vaccinated. And if you're pregnant, then it increases your chances of complications with the pregnancy, so you may get premature birth or even stillbirth because of measles. If you've got problems with your immune system, so if your immune system doesn't work properly, then if you catch an infection like measles, you can become a lot more unwell.
You're a children's doctor.
Yeah.
Have you seen children coming in with measles?
Yeah, so I work in children's A&E. I work at the forefront of everyone that walks into the hospital if you're a child or a young person. And we, for a long time, didn't see many measles cases, but more recently, we've definitely seen more. The vast majority of them are okay. It's a really unpleasant illness. It makes you really unwell. It's miserable for the entire family. But there is one case that sort of sticks out in my mind when I was working in children's intensive care. And there was a patient who got so poorly because they had measles pneumonitis. That's when measles affects your lungs, that they weren't able to breathe effectively for themselves. And in that particular case, that child hadn't been vaccinated.
The MMR vaccine protects against 3 serious illnesses: measles, mumps and rubella. 2 doses provide the best protection. The first is usually at 1 year old and the second at 3 years and 4 months, but anyone who's missed it can still catch up. Do you still get parents asking about that completely debunked link between autism and the MMR vaccine?
We do. We do, because that misinformation is still out there, and it's, you know, people are still talking about it and are still worried about it. And I get it. I understand. It's really scary.
There's been a trebling of children with measles. Doctors blame the increase on the health scare over the MMR jab.
The doctor who linked the MMR vaccine to autism has been struck off.
But if I can reassure anyone in any way, is that the study that all of that was based on has been completely discredited.
And it was just 12 children.
It was 12 kids. Since then, millions of children have been vaccinated with MMR without an issue. Loads of studies, independent around the world, have been done that haven't shown a link. And from my own personal experience, if anyone finds this helpful, my nephew's autistic. He had signs of autism before he'd gone anywhere near an MMR vaccine.
Do you think people have forgotten about how serious this disease can be?
Absolutely. In 2017, the UK was declared free of measles. Then, unfortunately, that was revoked because cases started to go up again. And the reason those cases rise is when something is eliminated, we forget about it. We forget how serious it is. The vast majority of kids who get measles will get better, okay, within about 7 to 10 days. Currently, 1 in 5 cases of children with measles are being admitted to hospital for treatment, unfortunately. And a small proportion of those are going to end up in intensive care. They are going to be very, very poorly. You can get ear infections at one end of the spectrum, but it can go to your lungs and cause pneumonia. It can go to your brain and spinal cord and cause meningitis and encephalitis. And the most sad part of all of this is that 1 in 5,000 will die because of measles. And even if you manage to make it through the infection, a lot of people don't know this, but there is a very rare complication that happens to about 1 in 10,000 cases. And it mainly affects kids and young people. And it can affect you anywhere between sort of 5 to 15 years later after you've had measles. There's a complication called SSPE. It stands for subacute sclerosing panencephalitis. It's an inflammation of the brain. And the worst part of it is it's progressive and it's incurable and it's pretty much universally fatal. Sure, the majority of kids and young people will be fine, but you don't want to be that person that ends up in that situation where we can't do anything for you.
I'm a parent, I've got 2 young kids. Parents, they want the best for their kids.
Absolutely.
But, you know, it's normal to have concerns, queries. What kinds of queries are you hearing?
The most common things that people will ask around are side effects. And for the vast majority of kids that have the MMR vaccine, the side effects are mild and they're short-lived and they're not serious. They might get something like a bit of a temperature, a bit of a sore arm. Counterbalance that with how effective that vaccine is. If you're fully immunised with MMR, it's 99% effective at fighting off measles.
So why are the herd immunity numbers so low at the moment? Why are we so far from that 95%? Today, around 3.4 million children under 16 in England haven't been fully vaccinated against measles, and it's a situation that didn't happen overnight. You can see in this graph that the percentage of children who've had their 2 MMR vaccines in England has gradually fallen over the last decade, and that is having serious consequences. Helen, you've been studying this for years. Why is there this decline in children taking up the measles vaccine?
So way back in 2013-14, there was a big reorganisation of the NHS, and this meant that the way vaccine services were provided was reorganised, and with different organisations looking after different parts of it. And this caused a lot of disorganisation, really, with people not knowing who was responsible for various parts of the system. Austerity has also impacted on this. So we've had reductions in the Public Health Fund, which will affect vaccination services, and then increases in mobility, so mobile populations have difficulty often accessing vaccination services. Parents need to be reminded that their children are due vaccination.
I mean, there's loads of different vaccines at different times.
Loads of different vaccines, and also families are busy, parents are busy, going to work, you know, maybe have more than one child, so children going to different places at different times.
It's not always easy taking time off to get these vaccines.
Absolutely, or you don't get paid if you take time off, so it can be difficult for parents. And then on top of that, there's poverty. So we know that children in the most deprived areas are less likely to get MMR. And what poverty does is perhaps vaccination becomes less of a priority. So with the best will in the world, even though you want your children to be vaccinated, it's not top of your list of things to think about. How to feed your family may be more important than getting them vaccinated. So we need to think about access very, very carefully.
What other reasons are there behind this decline?
Pressure on general practice. We hear every day about the pressures on the NHS, but also things like reduction in health visitor numbers. So since 2015, there's been a 40% reduction in numbers of health visitors in England. And this has had an enormous impact on lots of aspects of child health.
There's lots of terms that are used about why vaccine uptake isn't as high as it needs to be. One is vaccine hesitancy. What does that mean?
I interpret it to mean somebody who is maybe undecided. They're sitting on the fence, they don't know what to do. It's very different from the term anti-vaxxer, and I don't think we should combine the two. Sometimes you hear people referring to people who have questions as being an anti-vaxxer, but there's a world of difference between somebody who's simply got questions and concerns and somebody who is actually believes that vaccination is a bad thing. And we need to be better at offering advice to everybody.
Is it your feeling that anti-vaxxers is a much smaller percentage of the problem than it's perhaps made out to be in the media?
Absolutely, it's a good story, isn't it? And I think there is a lot of anti-vaccine sentiment around if you look for it. The concern is that if somebody's on the fence, so-called vaccine hesitancy, that sort of information may influence their thinking. And what we need to do is make sure that the gap is filled, if you like, that information gap is filled by health professionals who can give good, appropriate answers to people's questions.
There's real concern at the moment from public health officials because cases are rising in the West Midlands and in London. What's it looking like in the rest of the UK?
Well, Scotland, Ireland and Wales always have better coverage than England. The problem in England, if you like, is London. If you took London out of the equation, our uptake would look very much better. So overall in London, for example, a quarter of children, 5-year-olds entering school have not had the 2 doses of MMR needed for best protection. And in other big cities like the West Midlands, uptake are at similar levels. There's a new national campaign being offered to children aged 6 to 11 to make sure that they are invited in to have their vaccines if they haven't had them. And then in areas of low uptake, particularly London and the West Midlands where we're seeing outbreaks, older individuals aged 11 to 25 are also going to be invited in for vaccination.
So it looks like one of the big issues here is about actually making it easier for people to get hold of the vaccines. Trust is another issue. Next up, we've got Selma, who's going to tell us about how she's been working on this in her community.
With the mistrust in the NHS, it's something that we need to work together. We all need to be a part of the community. It's not just the Somali community, it's every ethnic background community, and it's something that is above one group.
When does this mistrust start?
It started before I was born. It started many, many years ago. For example, my mum, when she first came into the country, English wasn't her first language. She had to learn how to speak English. And even then, she didn't feel like she was being told what was the reason that she needs to be giving her kids the MMR vaccine. She's just been told, you need to get the MMR jab. She's thinking, what on earth is this?
Tell us what you've been doing in your community.
We held a community conversation, we held focus groups to find out why the reason the Somali community aren't getting themselves vaccinated, and everybody was able to ask firsthand the medical professions in the room, as well as have everything translated to them, so they were actually able to understand. Let's talk about the MMR vaccine, an essential tool to help protect you and your community. We were approached by Bristol City Council and the NHS. So we've been asked to do a film, to do myth busting and to get correct information about the MMR vaccine out there to the community.
What kind of things have you covered in your film?
So we spoke about the fact that there is a gelatin-free version of the vaccine and it comes in 2 doses. We spoke about the language barriers of people not understanding English as their first language and being able to access correct information, translated information, so they are able to understand what MMR is and what it protects you against.
And there are religious leaders who say, actually, it's fine to even get that because you're protecting your children. Yes, religious leaders have said the same thing. We've approached imams, had conversations with them as well, and they really do encourage people in the community to protect themselves against the MMR illnesses and protect our community. So have you seen people change their minds?
Yeah, and during the last week's community conversation on Thursday, there was one lady that said, I'm going to actually book in my appointment and get my sons vaccinated. So we was really pleased with that outcome because she was very, very anti-MMR vaccine.
You've spoken lots about getting the right information to people so they can make the informed choices. Where are people hearing the wrong stuff from?
So I know a lot of people in the Somali community, they go to Somali coffee mornings in the community and they all give each other information and they send it on WhatsApp groups. So everybody is recycling information that is incorrect.
When people talk about under-vaccinated groups, they often talk about ethnic minority groups or poorer areas. And I know from experience that doesn't always feel comfortable and doesn't always give the full picture of what's going on. What are your thoughts on that?
Pointing the finger at one community is going to make them turn around and say, well, actually, you guys keep pointing at us to say we're the ones not taking the vaccination and we're the reason. They won't take it. I'm sorry, but they're not going to take it. Just because somebody lives in the poorer economy or in the inner city, for example, doesn't mean that they are the sole reason that the vaccination uptake is low.
Dr Ranj, you're back in the hot seat. Yep. And we're going to have a bit of a quick fire round. We've scoured the internet for the most common questions on measles. Ready?
I'll give it a go.
Okay, measles rash, is it itchy?
Classically, no. It's quite significant, like it spreads from around the ears and the face all over the body. It looks fairly traumatic, especially in paler skin. It can look different on different types of skin, so it's important to remember that. It can be harder to detect on darker skin, actually. It tends not to be itchy.
Can you get measles more than once?
You can. It is possible. It's unusual, particularly if you've had measles before or if you've been vaccinated, but as we all know, as you get older, your immunity can wane a little bit and you may be more likely to get it. If for some reason you just haven't happened to have responded to your vaccines, you could potentially get it again.
You'd have to be pretty unlucky.
Yes.
Can I go to work if I've got measles?
Absolutely not. So the advice is, if you've got measles, stay at home, minimise contact with others, especially vulnerable people, pick up the phone and speak to a healthcare professional. That could be NHS 111 or that could be your GP, local GP, whoever it is. And the reason being, you're probably going to be okay. You're probably going to recover within sort of 7 to 10 days in the vast majority of people, but we need to know that you might have measles or we need to know whether you've definitely got it because we need to keep an eye on cases. You definitely shouldn't be going to work because, as we know, it's highly infectious and you're going to pass it around.
The Department of Health and Social Care said, "We are committed to improving vaccination uptake rates to fully protect the public from preventable diseases and are urging parents to make sure their children have received the MMR vaccine to prevent further outbreaks of measles. The vaccine is proven to be safe and effective." The UK Health Security Agency and NHS England have been engaging local communities to highlight the importance of vaccination and make sure people know how to access the jabs as quickly as possible. NHS England said the NHS vaccination strategy takes lessons from our world-leading COVID-19 vaccine programme to offer jabs in more convenient places, improve vaccine confidence and expand work with trusted community leaders to encourage as many people as possible to come forward. It is vitally important that those who are eligible come forward for their dose of protection.